So without much ado, let us welcome Dr. Villa from Florida, USA.
Okay, hello everyone. And Emily, thank you for mentioning this disclosure. And that is the case. I don't have any conflict of interest to anybody. So it's good morning for me here in Florida and good evening for all of you there. And so, first of all, I'd like to thank the organizer, Emily, and Ted Lutzine was actually very instrumental in bringing me here. So thank you so much for inviting me, and I hope that we can share knowledge and give some explanation and clarification on what we have to do with this pandemic, with this virus. So let's see. What we are going to, it's not working. The next slide. What we are going to try and tackle tonight is really understand, the treatment and the recommendation, the current recommendation on the treatment of this disease. I would like to present to you what the Philippines treatment recommendation right now. I actually reviewed it because I saw it in one of the official posting on Facebook by one of the authorities. I believe he is the one advising the Philippine government or whatever authorities involved in the management or in the control of this pandemic. And so we are going to see, we're going to compare how what we should do. I think what we should do compared to the recommendation or the current recommendation of treatment in the Philippines. Okay. I'm just showing that that's one of my favorite room in the practice. It's a very special room. I do procedure in that room, but just to show you, just to give you a brief introduction about what I do. Well, basically, I'm a pulmonologist, intensivist practicing in this town called the Villages. And basically, this town is very, very unique because it is the largest retirement community in the U.S. If not in the world. We have at least 150,000 residents, and they are all retirees. The age range is between 65 to 90, even up to 100. We don't have so many centenarians, but we have a lot of this age between 65 and above. And to tell you, this population, they have the pre-existing, high-risk pre-existing condition, comorbidities, which is all we know that it is one of the high risk for the disease. And obviously, they're also in the right age to be hit by this virus. So that's where I practice. It's called the Villages. You guys can Google that. It's actually a very interesting community. Some of the patients, they come to my office in their golf carts because it's a golf cart golf courses all over the place. So this is what I'm going to say. We will understand the how to prevent or the prevention and early treatment of the disease. This is very important because since the very beginning, and the U.S. was not excluded or exempted from it from the beginning of the pandemic last year, we didn't do anything really. When the patient gets sick, we just send them home, and it's a very scary thought to be waiting at home and do nothing. So we will try to dissect that. But to do that, we're going to be reviewing the disease process of COVID-19, and that's going to be in a few slides coming following this. So just to review a little bit, the risk factors, I want to emphasize this. Everybody should remember this, it's very important. What are the risk factors for this disease? Number one is advanced age, 60 and above. You know, they are very susceptible to this disease. The presence of comorbidities, the presence of pre-existing high-risk condition, irrespective of the age, will be susceptible and high risk for this disease. And the most common are the cardiovascular disease, hypertension, coronary artery disease, those people who already had heart attack, and existed those people with stents and all that, congestive heart failure, and then diabetes, this endocrine problem, which is also a disease that will cause a lot of other diseases, including the cardiovascular, issue. People with chronic lung disease are very high risk, the COPD and emphysema, asthma, things like that, or any other inherited or genetically caused chronic lung disease. People with cancer, the most susceptible are the blood cancer, and obviously the lung cancer, and then very high risk also. Those people are suffering from advanced cancer already, the metastatic disease. People with chronic kidney disease, the kidney transplantation. I'd like to emphasize number three, which is obesity. The weight issue is a very big issue because it's an independent risk factor or determining factor for both the severity and mortality. Even the young people, when we admit them in the hospital, they die from this when they are very obese. And the reason for that is overweight people, they have more inflammation, and they have more of the receptors of the ACE receptor, where the virus attaches and then causes the infection. People who are smoking are very high risk for this disease. So try to remember that, because those are the especially vulnerable people for this disease. Okay, just a little statistic. This is actually from last week, but worldwide, we already have more than 141 million cases, 3 million, more than 3 million fatalities. Here in the US, we have more than 32 million, and we actually have more than 570,000 deaths already. In Florida, we have more than 2 million cases, and we have more than 34,000 fatalities. And in the Philippines, and this is from last week, you're very close to 1 million cases, and I think you are more than 16,000 deaths today. Okay, so for us to understand the recommendation of treatment, I would like to go into what we call pathogenesis and pathophysiology. I heard that there are doctors attending, so this is very good, because we want to recruit more doctors to get involved in the treatment, because that's one of the components of how we are going to control this pandemic and decrease the impact on the lives of people. Okay, so we're going to learn a little bit. So those people who are non-medical, I tried to make it as understandable for the non-medical people as possible, but I'd like to emphasize this on the medical people, so you just listen. Okay, so the disease, the COVID-19, has are we okay? Okay, so the two basic stages of the disease, you have stage 1 and 2, the viral stage and the immune stage. In the viral stage, it's all about the virus, okay? Now, what I would like to emphasize to everyone, the virus itself does not kill you. It doesn't kill people, okay? But what we die from on the second stage is the immune stage, is the response of the body, of our immune system, that will kill people. So in the treatment recommendation, we should do everything not to go into the immune stage or do everything to lessen or mitigate the effect of the immune response. And now this disease uh, goes into phases. There are 5 phases: phase 1, 2, 3, and 4, and all these phases will fall onto the specific stage. Okay, so we have, in the viral stage, we have phase 1 and 2, and then 3 and 4 on the immune stage. The 5 phases, phase 1, 2, 3, and 4. The phase 1 is the incubation period, which is about 1 to 5 or up to even 7 days. And phase 2 is the symptomatic uh, period, which is between 5 days, 5 to 11. The phase 3 is the early pulmonary phase, 11 days, 11 to 14, and the late pulmonary phase, days 14 to 28. And this is the phase that you don't want to be in. Phase 5, I put it there. If you look at literature or something, they still don't add that as a phase 5. But to me, it is included as one of the phases of the disease, because we're seeing that more and more since last year. We see the long hauler, now those people who were infected in the beginning of the pandemic. So the phase 5 is the prolonged systemic immune response. I put it there, but they are usually known to be long hauler or the post-acute COVID syndrome. And then they're usually diagnosed when they go beyond 4 weeks or 5 weeks or 6 weeks. Okay, we will also discuss the different severity of the disease. And this is actually the basis for the recommendation of treatment. So as I discuss the different severity of the disease, I am going to put or tell you what is the recommendation in the Philippines. Okay? So we have 4 different levels of severity. Number 1 is the asymptomatic, which falls on the phase 1 of the disease. The mild severity is phase 2, and the moderate severity is the phase 3. And phase 4 is the critical or the severe or critical state. Okay, so discussing specifically, try closing application to improve performance. Okay, so the asymptomatic state corresponds to the phase 1, which is the incubation period. Actually, this is more like a pre-symptomatic state, because that's what it is. In this, I want you to remember that in this phase 1 or asymptomatic state, this is the phase wherein the viral replication is very high, and it is very contagious. The thing with this, obviously, the patient is completely feeling well, even with a high viral load, so no symptoms. So this is the time that the disease is actually very contagious. The disease or the virus is being transmitted, even the person doesn't know that he's transmitting it. Okay, so that is that state or phase. Now, this is the recommendation treatment in the Philippines. Asymptomatic, you don't do anything. The thing that you do once they get tested positive, they send them, I guess, or you guys have a isolation facility. We don't have that here. We send the patient home. The problem with this in the beginning of the pandemic, when the patient knows that they are or he or she is positive for the virus, when you send them home, they get scared so much because you just say there's nothing to do. So they wait at home and they are just thinking, what is going to happen to me? Am I going to get worse? Am I going to get dead? So in the beginning of the pandemic, it was very difficult for me because they want to talk to me 24 hours a day, literally. So there are some patients like that. And so, but I did a different thing. I didn't send them home just like that. What I did, I have a functional medicine background, so I do a lot of nutrition intervention. And so the first thing that I did to them was, since there is no recommendation, I gave them a lot of immune boosting supplements, and advise them on their diet, on exercise, anything that will make them healthy and make the immune system, the natural immune system, healthy or stronger. Okay, so the next phase. This is the mild severity. Okay, this corresponds to the symptomatic phase. The patient here will present to you with mild symptoms. Could be fever, malaise, cough. Cold symptom. They can have a mild headache, and this is where you lose your smell and taste, and they could have mild diarrhea. And if you take an X-ray, it's possible that they have a very subtle or mild infiltrate. And if you are not looking at the X-ray very well, you can even miss it. Okay, this is the phase where in the viral replication peaks. You know, and the good thing about this phase is, you guys have to remember, viral infection are self-limiting. They go away by themselves. If you have a strong immune system, it will go away and probably will stop here, and you don't have much consequences or complication. So there is a viral decay. Viral replication peaks and it starts going down before it goes to the next phase. And this is basically where the height of the viral replication occurs, and then it goes down. And then, very important, this is where the immune response will start. Your immune system will try or will start to wake up. And this is where the immune system realizes that there is something in your body that is not supposed to be there. So it's called delayed natural immunity, or natural immunity. Everybody has this. You have to remember, the natural immunity is very strong when you're young. That's why people who are young and gets this disease or this infection, they do it very well. They don't get sick. They don't go into any further, stages or severity. And so the natural immunity, unfortunately, it starts going down, or it goes down with the advanced age. It goes down when you have other diseases that you have to deal with chronically. Okay? And nevertheless, this stage is still very contagious. And so between phase one, phase two, asymptomatic and mild symptoms, it's very contagious. This is where people spread and transmit the disease. Okay, so what is the recommendation in the Philippines? Mild severity, as you can see, it's still supportive. Nothing, they don't do, they don't recommend anything, and no medication required. No medication required. And you are going to realize when I project the other slide that this is a very big mistake. So this is basically a do nothing approach, which is going to entail a lot of sick people in the end. Okay, so what you have to pray for is the disease stops here, and then nothing else happens. And that's usually the case in the young people. I cannot overemphasize that. That's why the survival rate of this disease in young population, less than 50, and the younger you get, the stronger it is. The survival rate is like 99%. 98, 99%. Okay. So nothing. They're not recommending anything. You just have to go home alone again or go into the what do you call this? The isolation facility. And still you don't know what's gonna happen to you. So for people who are just waiting what to happen and then knowing that this patient, this disease is actually potentially very fatal, what is created is fear. So people become very fearful. Okay, the moderate severity, this is where we start having problems. Okay, so this is called the early pulmonary phase. You are not going to miss that the patient is sick in this state. Okay, the patient is more symptomatic, coughing more fever, and the patient will start having the patient will start having shortness of breath. This is actually where you will see that the oxygen level of the patient is going to start dropping. When somebody drops down to 94% of oxygen or lower, that is an ominous sign. That's very bad. So at this stage, we might want to start already supplemental oxygen. And this is also the state or the phase wherein we have to decide whether the patient goes to the hospital. And in the case in the Philippines, I heard that they're waiting outside the hospital and actually dying right in front of the hospital in the tents, because they have makeup tents outside. So if you take an X-ray on this phase, you will see pneumonia. You will see pneumonia. It is not completely whited out the lungs, but you will not miss it. Even regular non-medical person, if you show the X-ray of this patient, show pneumonia. One thing that we have to remember in this phase, it has very minimal viral replication, minimal to none. Because remember, the phase 2, the viral is already starting to decay. And this, the viral replication is very minimal. And but sometimes in some patients who are immunosuppressed, it could still be active. Okay, and the immune response here is like becoming more and more active. This is the prelude to the cytokine storm. Okay, so what we have here in this state, since you don't have much viral replication, you don't have much viral live viruses, you actually have mostly viral debris. Okay, so the remains, dead viruses. However, the immune system, your immune system will continue to respond as if there are still live viruses. And this is where your immune system will go crazy. It goes crazy, it gets confused, and instead of protecting you, it will actually damage you or harm you. This is where we see the beginning of immune dysregulation. And this is very abnormal because this is not going to protect you, it's going to harm you. Okay, this is, I said, the beginning of the cytokine storm, and then the patient is either getting ready to go into the ICU or already in the ICU. One thing with this phase, we see here happy hypoxemic. What does it mean? The person or the patient has a very low oxygen, and yet, they're talking to you, they're okay, they're not short of breath. And those are the people with good immune system, but decided to go into the immune, stage. So, but nevertheless, it gets scary when you see somebody talking and smiling, and then the oxygen is in the 80s, on the 80s. Under normal circumstances, or if it's any other diseases, that person is going to get intubated. You're going to put a tube down the throat, and then you're going to put them in the ICU and get ventilated. So this is very important. And remember this, because the timing or the introduction of the medication, this is the most important phase that we're going to make. The doctors should make a decisive and very fast application or administration of the medication if you don't want the patient to go into the severe stage and die. Okay, next. Somebody, okay. So the treatment recommendation in the Philippines is this. Still supportive only, so still nothing to do, no medication required. And if you are one of those people who are high risk, so we're talking about the pre-existing high risk condition, then maybe you will be given antivirals. No, these are the antivirals that you're using in the Philippines, but the most used or most popular is the remdesivir. This is Avigan, the favipiravir, and this is not available in the U.S. It's from Japan, but I don't know, it's available with you guys. But the most commonly used antiviral is the remdesivir, and in the Philippines, you use it via compassionate use. I am not a big fan of compassionate use, because I'm going to tell you, when they say compassionate use, whatever medication it is, at the end or in the end, you only get compassion. You don't get benefit from the medication that's being used. Okay. One thing I'm going to tell you already, what is wrong with this recommendation? What is wrong is they're giving the antiviral agent at the time that there are no more viral replication. So what do you think is going to happen? How are you going to kill a virus that's already dead? Remdesivir is not an anti-inflammatory, it's not an immune modulator, it's purely and just only an antiviral. So in reality, the remdesivir should be given in the phase wherein there is viral replication. So I don't know the rationale. That let's stay on this. So this is the recommendation of in the Philippines for a moderate severity. Okay, so basically it's only supportive care and no medication required. And if you are a high risk person, probably or maybe they can give you the antiviral agents, and it's by compassionate use. My problem with this, the most commonly used antiviral in the Philippines that everybody is pushing, whether it's the doctor or the hospital, is remdesivir. The remdesivir, my problem with this is they're giving it in that phase wherein there is no more viral replication. You get that, right? You cannot kill the virus when it's not there anymore or it's not live anymore. That's why a lot of times when you give this medication, nothing happens. Did not, this medication was approved, but it did not make any difference in terms of the mortality. And so they had to say that it actually decreases the length of stay in the hospital. So if you are very bad, you're given this, then you're going to die. And then those people who are lucky enough to survive, then they said that it lessened the number of days or stay in the hospital, and probably for by 2 or 4 days. Okay, so next slide, please. Um, I cannot control my slide here, unfortunately. I cannot control my slides. So you guys can, oh, okay, there it is. All right, the severe or the critical state. This is corresponding to the late pulmonary phase or phase 4. And this is the state or the phase that you don't want to be in, because this is the one that I'm going to tell you, okay, especially for the old people. This is this phase that you have progressive hypoxemia that will not respond even to the highest amount of oxygen you give. So the patient is going to be intubated in full ventilatory support. The pneumonia is very severe. It's on both sides. Nobody will miss it because it's all whited out, or the entire lungs, both lungs are affected. So the patient is going to be in full-blown respiratory failure, and then definitely the patient should be in the ICU. This is where the cytokine storm is in full force. You're going to have a lot of inflammation. And I'm going to tell you guys, we've never seen, in my ICU career, we've never seen any disease like this, that the inflammation is so bad and so high. It becomes like it has a systemic inflammatory response, that it is not only the lungs that are affected, it will affect any organ in your body. And when that happens, you get into the patient goes into shock. The patient goes onto what we call MOSF, which is the multi-organ system failure. Okay, and so and because of this inflammation, the patient is also going to have this blood clot formation. The clots are being formed all over the place, whether it's micro level or macro level. No, small blood vessel, big blood vessel. So depending on what organ is affected, if it's in the brain, you're going to have stroke if you form blood clot there. In the heart, you're going to have heart attack. And then the kidney, it gets clogged up, and then you have kidney failure, liver failure. So I've seen patients, they had the blood clots in the extremity fingers. They survived, but all the fingers were amputated. Same thing with the toes, because they develop gangrene. Okay, and when the patient is in this state, we don't talk about the virus anymore. We just talk about what can we do to keep the patient alive or to make the patient survive. So the prognosis on this stage is dismal, very poor, and I am sorry to tell you, in our ICU there was one time we had how many? I think 15 or 16 COVID patient all intubated, and they're all in their 70s and 80s. And then there's one 62-year-old. She was the only one who survived and made it out of the intensive care unit. The rest, so it's like a 99% mortality once they get in there. At least in my ICU. There are other ICUs. I have friends. I talk to them, directors of other ICU here in Florida and also out of state. Okay, so this is the phase or the stage that you don't want to be in, because it's very hard. It's beyond challenge to turn the patient around when the patient is already in this critical state. Okay, and if they made it, I'm going to tell you, they are going to require still a high level of medical care. It's a very costly period and treatment, and then also they require a lot of what do you call this, rehabilitation. And these are the same people that would also go into the long hauler state. And then the thing to that, aside from the virus doing the long hauler, when you go into this critical state, there is another disease that you can acquire just for being very sick. They develop neuropathy. It's a neuropathy of critical state. it'll kill it. And so it's very challenging to keep this patient after this to have quality of life. The older folks, the quality of life after this is like very low. Okay. All right. So, what is the recommendation in the Philippines? This is the treatment is obviously oxygen. Thank you. At least they tried to give you some oxygen now. And then that's where the dexamethasone comes in. You know, everybody knows that use of corticosteroid makes a big difference in terms of the mortality. When they did the recovery trial that was done in UK, it 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 reduced the mortality rate by 30%. So what more if you use this earlier? This is late. You know, this is late application of corticosteroid. I do it much earlier, and you're gonna see when we go to the actual, treatment recommendation that we are advocating right now. So this is also the state that they recommend immune modulator, the famous tocilizumab. Um, it's in the process of getting approved here in the U.S. to become, full blown for full blown usage. But I'm also not a big fan of that, not really, because it's not they cannot decide whether it really affects the mortality rate, whether it makes it go down or not. Okay, and there's another immune modulators. There are other ones that are being tried for this, but I'm for the sake of just discussing what the Philippines uses, then that's what you guys use in the Philippines. Then here it is again. They're still giving the antivirals, and I made a red, or I colored the remdesivir as red, because I think, to me, this is unethical already. If you're still giving the patient who is intubated and you're still pushing the remdesivir to make it 10 days aside from, or instead of 5 days, I think this is already very unethical, because what's going to happen if the patient is already very sick? The complication from this medication is going to make the patient even sicker, or even contribute to the demise of the patient. And again, it's being given as compassionate use drug. And so good luck to that. You're going to get compassion. So the mortality rate, as I've said, is very high in this state.